Drugs and supplements to enhance performance. When students have completed this content, they should be able to explain the FDA approval process for supplements intended to treat or cure health conditions, describe supplements and performance-enhancing drugs that athletes may be tempted to use, advise athletes about banned and potentially illegal substances, use appropriate resources such as pharmacists, prescribers, and natural medicine databases to inform athletes about supplements used for treating musculoskeletal and neurological conditions, and describe how athletes might manipulate approved medications to enhance performance. Products that claim to prevent, treat, or cure health conditions such as Alzheimer's disease, diabetes, and cancer are being illegally marketed as new drugs. The claim of these products, many of which are marketed as dietary supplements, have not been proven, nor have products been approved by the U.S. Food and Drug Administration, the FDA. To help ensure that supplements are safe and effective for their intended medical use, products intended to treat any health condition must gain FDA approval before being sold to consumers. A new dietary ingredient notification allows the FDA to evaluate the safety of new ingredients before they become available to consumers. Athletes use nutritional and dietary supplements to enhance both general nutrition and performance. Since the era of the Roman gladiators, athletes have ingested herbs with the hope of gaining a competitive edge. A study from 2009 illustrated this commitment to win. 52% of a cohort of competitive athletes indicated that they would take a drug guaranteeing success even if it resulted in their death within the next 5 years. Athletes may be tempted to use different drugs, even to supplement injury care. Athletes in the past have used different supplements, often at times with disastrous results. Athletic trainers need to have a good understanding of banned and illegal performance-enhancing drugs, also known as PEDs. Although many nutritional supplements are used for general health, some athletes use them to become bigger, faster, and stronger. Much of the ergogenic abuse of supplements pertains to those that enhance performance through strength development. An athlete, by accident or by design, may indulge in a substance that is banned by the various agencies that oversee performance-enhancing drugs. The World Anti-Doping Agency, or WADA, WADA, is the primary agency that has developed a list of banned substances that may give athletes a competitive edge or enhance their performance. This list, which is reviewed annually, outlines the substances that disrupt the level field of competition and serves as an international standard. The United States Anti-Doping Agency is the domestic governing body that oversees American competition that subscribes to drug testing to prevent or detect doping. Most major competitive sports leagues in the United States subscribe to all or part of the WADA philosophy and use their model of banned substances in their respective competitors. Supplements for enhancing musculoskeletal performance. Supplements and performance-enhancing drugs that are commonly used by athletes and other physically active people to facilitate muscle hypertrophy and strength include anabolic androgenic steroids, or AAS, human growth hormone, and creatine monohydrate. Anabolic steroids gained popularity following the 1954 World Weightlifting Championships and expanded to other international competitions during the 1960s. In 2004, the United States Drug Enforcement Administration, or DEA, enacted the Anabolic Steroid Control Act, which defines anabolic steroids as any drug or hormonal substance that is chemically and pharmacologically related to testosterone, other than estrogen, progesterone, corticosteroids, and dehydroepinestrone. The legislation revised the definition of anabolic steroids for inclusion in the class of Schedule III controlled substances by eliminating the requirement that an anabolic androgenic steroid improved muscle growth. Despite contemporary protocols for drug testing and education, anabolic steroid use has been prevalent in elite international, professional, and intercollegiate sports. A review of WADA-approved laboratories indicated that 45% of all 2006 drug tests were positive for anabolic steroids. In 2012, the National Athletic Trainers Association considered it vital that sports medicine practitioners understand the vital nature of anabolic steroids and recommended that these practitioners serve as resources of accurate and reliable information regarding the effect of anabolic steroids on health. The risks and benefits of anabolic steroid use are well documented. However, despite the potential for adverse events, anabolic steroid use to enhance performance or for cosmetic purposes remains common. Unfortunately, there's no good evidence for the medical application of any anabolic steroid. Anabolic steroids are manufactured derivatives of testosterone, the endogenous hormone responsible for the development and maturation of secondary male sexual characteristics. Research has established that fat-free mass, muscle size, strength, and power correlate with serum testosterone concentration, which is the philosophic basis for the role of anabolic androgenic steroids as a performance-enhancing agent. Anabolic androgenic steroids can compromise various metabolic systems, which can be a detriment to the athlete's health. Despite the actual or anticipated ergogenic benefits of AAS, the list of adverse effects is lengthy and significant, with dose and duration-related effects. Athletes seeking ergogenic gains generally use doses that are many times beyond what is considered therapeutic, and thus are more likely to experience severe adverse effects from overuse. Body systems adversely affected by anabolic androgenic steroids include cardiovascular, general cardiac dysfunction, hematological, increased cholesterol, the hepatic system, including jaundice and liver dysfunction, neuroendocrine, in men, testicular atrophy, sexual dysfunction, gynecomastia, libido changes, and prostate hypertrophy, and in women, general virilization, clitoral hypertrophy, and menstrual dysfunction, and renal kidney stones, renal cell cancer, and focal cell glomerulosclerosis. Another significant health risk is the effect of anabolic androgenic steroids on the central nervous system, specifically on mental and behavioral health. Studies have identified that up to 60% of AAS users report some form of aggression or irritability. This increase in aggression, termed roid rage, may be considered a benefit in contact sports. Other psychological effects of anabolic androgenic steroid use could include mood swings, psychosis, addiction, and depression. The diagnosis of androgenic anabolic steroid dependence has met the standard of the Diagnostic and Statistic Manual for Mental Health Disorders, or DSM, for substance use disorders. Although the DSM criteria was not intended for AAS dependence, research has identified that approximately 30% of steroid users met the DSM criteria. People dependent on AAS had a lifetime prevalence of childhood conduct disorder, lower levels of educational attainment, and a higher frequency of abusing other substances, particularly opioids. An initial driving force behind the onset of AAS dependence is a body image disorder. People with muscle dysmorphia see a normal, healthy muscular body as being weak and small. This mental health condition has been described as reverse anorexia nervosa. Human growth hormone is a naturally occurring peptide hormone secreted in the pituitary gland that fluctuates in concentration throughout the day. It is affected by factors such as sleep, stress, and exercise. It is at its highest levels during puberty. Under normal circumstances, human growth hormone plays a critical role in human physiology. This hormone stimulates skeletal and organ growth, and assists in regulating the immune system. Some people interested in performance enhancement or bodybuilding are attracted to the potential for increases in muscle mass or decreases in lean mass that could result from human growth use. Numerous professional baseball players have abused human growth hormone to enhance performance. In addition, human growth hormone is popular among female athletes who use androgenic anabolic steroids to avoid the symptoms associated with steroid use. Human growth hormone is sold by vendors such as anti-aging clinics and has been used by athletes at various levels. Human growth hormone is not recognized by the FDA as a viable treatment for athletic injury care and has been banned by all major drug testing agencies and sport governing bodies. The penalty for a positive human growth hormone test are significant and severe. However, conducting human growth hormone testing is challenging. Human growth hormone half-life is approximately 4 hours for a subcutaneous injection and 22 minutes for IV administration. Human growth hormone is 100 to 1,000 times less concentrated in urine than in blood, and blood testing must be conducted within 24 hours of human growth hormone administration in order to have the best chance of detecting the substance. Physicians who have prescribed human growth hormone as a performance-enhancing drug have lost their license. Creatine monohydrate, or creatine, became popular in the 1990s as a supplement that increases muscle mass without the side effects of the anabolic steroids. Creatine is an endogenous substance that is synthesized naturally in the liver, kidneys, and pancreas. The substance is found naturally in meat or fish products and can be ingested as a nutritional supplement. Creatine may play a role in the resynthesis of adenosine triphosphate, or ATP, during exercise. Although performance enhancement was the initial purpose for using creatine, both science and contemporary culture associate this supplement with enhanced recovery for the following conditions: Parkinson's disease, spinal cord injury, and sport-related concussion. In Parkinson's disease, patients with mild to moderate Parkinson's disease who supplement with creatine monohydrate had improved lean mass, local muscle endurance, and chair rise performance compared to the control group. In spinal cord injury patients, in general, creatine supplementation contributed to increased upper extremity work capacity and oxygen uptake based on ergonometry training and testing. And sports-related concussions. Based on a systematic review, animals supplemented with creatine exhibited a resilience to traumatic brain injury that may be similar to traumatic brain injury in humans. However, as of 2017, no conclusive evidence has been found that nutritional supplements have a neuroprotective role in humans. Supplements for treating skeletal conditions. Osteoarthritis is one of the most common forms of arthritis and presents as pain and swelling and the result of gradual wear and tear and the loss of cartilage in the joint. In general, the management of osteoarthritis has been relegated to non-steroidal anti-inflammatory drugs. However, over-the-counter supplements such as glucosamine and chondroitin sulfate, omega-3 fatty acids, vitamin D, and cannabinoids have been promoted as alternatives to prescription anti-inflammatory medications. Glucosamine and chondroitin sulfate. These are endogenous chondroprotectors that are natural components of cartilage and synovial fluid. These substances are considered symptomatic, slow-acting drugs for osteoarthritis. Clinical trials comparing a placebo to glucosamine, 1,500 milligrams per day, concluded that long-term glucosamine supplementation improved joint mobility and reduced pain in osteoarthritis progression and the risk of joint replacement. When incorporating glucosamine with strength training for osteoarthritic knee patients, a 13% reduction of serum cartilage, osteometric matrix protein, chondroitin sulfate inhibits cartilage degradation and stimulates the anabolic process for formation of new cartilage. Randomized controlled trials validated the efficacy of chondroitin sulfate as a disease-modulating agent with secondary pain relief to 1,200 milligrams per day as a single dose or divided into 3 doses of 400 milligrams over the course of the day. A 2-year study that combined chondroitin sulfate with glucosamine resulted in a reduction of joint space narrowing compared to the use of a placebo. Glucosamine and chondroitin sulfate are viable alternatives to NSAIDs and pain-relieving medication for patients with osteoarthritis. Decisions on supplementation should consider the extent of the pathology, existing comorbidities, and the patient's preference. Omega-3 fatty acids also play a role in joint health. In vitro studies demonstrated increase in collagen synthesis and decreased inflammation mediators, such as prostaglandin E, whereas clinical studies concluded success in the treatment of rheumatoid arthritis. A study that combined glucosamine with omega-3 fatty acids and DHA reduced pain in patients with hip and knee osteoarthritis. Adding vitamins A, D, and E to the combination of glucosamine and omega-3 fatty acids resulted in an even greater improvement in pain in these groups. Vitamin D's role in bone health is well known, but it functions beyond bone metabolism by controlling genes associated with immune and inflammatory modulation that could affect immune system's functions. Vitamin D receptors have been located in virtually every tissue within the body, including bone, muscle, and the immune system cells. Sunshine is the most plentiful source of vitamin D, but certain factors impede this form of vitamin D production, including pollution, sunblock use, and pigmentation. Dietary sources of vitamin D include egg yolks, fatty fishes, and fortified milk. Inadequate vitamin D levels can have disastrous effects, particularly for bone health. Vitamin D supplementation is a standard component of bone health. Vitamin D supplementation frequently occurs in 1,000 to 500 international units. It may be available by prescription in as high as 50,000 international unit capsules. Observed vitamin D levels for professional basketball players have been defined as deficient at less than 20 nanograms per milliliter, insufficient at 20 to 30 nanograms per milliliter, and sufficient at greater than 32 nanograms per milliliter. When vitamin D level is low, below 32 nanograms per milliliter, parathyroid hormone levels increase, leading to bone reabsorption to meet the body's need for calcium, which in turn increases the risk for stress fracture. Insufficient vitamin D may be linked to inflammatory biomarkers that influence the immune system function. Cognitive functioning is also affected by insufficient vitamin D levels. The connection between vitamin D and athletic performance is inconsistent. Gains in sprint times and vertical jump were found with both vitamin D supplementation of 5,000 international units, but it was surmised greater than 40 nanograms per milliliter may be required to achieve sufficient strength gains. Blood doping is the practice of misusing certain techniques and substances to increase red blood cell volume. Since red blood cells, erythrocytes, carry oxygen to muscles, with blood doping, more erythrocytes are available to transport oxygen, thereby increasing aerobic capacity and endurance. 3 widely known substances or methods are used for blood doping: erythropoietin, or EPO, synthetic oxygen carriers, and blood transfusions. The primary uses of blood transfusions and synthetic oxygen carriers are for patients who have suffered massive blood loss, either during a major surgical procedure or due to major trauma. Erythropoietin is used in the treatment of anemia related to kidney disease or cancer. Misuses of these substances and techniques could lead to serious side effects, including the following: increased stress on the heart, blood clotting, and stroke. Erythropoietin is a peptide hormone produced by the kidneys that increases red blood cell volume by stimulating erythrocyte formation in the bone marrow, enhancing the oxygen carrying capacity of the blood. EPO used by athletes in competition was banned by the WADA in the 1990s, and testing for its use was introduced in the 2000 Olympics in Sydney. Beta blockers. The primary medical use of a beta blocker is to control hypertension, cardiac arrhythmias, angina pectoris, migraine, and nervous or anxiety-related conditions. Common side effects include hypotension, bradycardia, sleep disorders, and spasm of the airway. Beta blockers are on the WADA list of banned substances. Athletes in international shooting sports such as pistol, rifle, and archery see the beta blockers' adverse effects of bradycardia and hypotension as benefits for their sport. Although beta blockers are not approved by the FDA for treating anxiety, shooting athletes use them to ease tremors that could interfere with shooting the weapon and to reduce participation anxiety. Deer Antler Velvet. Deer Antler Velvet is one of many supplements sold through vendors and on the internet with marketed claims of improved athletic performance, strength, or testosterone levels. The assessment of New Zealand's deer antlers indicated them as a source of insulin-like growth factors 1 and 2 in the antler tips, free fatty acids, and the minerals calcium, copper, iron, magnesium, manganese, phosphorus, potassium, selenium, sodium, sulfur, and zinc. Supporting these notions is literature from Russian, Chinese, and Korean sources that describes the tonic effect of deer antler velvet. A double-blind study of subjects using deer velvet extract, 300 milligrams per day, deer velvet powder of 1.5 grams per day, or a placebo determined that subjects in the deer velvet powder group experienced improved isokinetic strength and endurance, but no improvements in testosterone, aerobic performance, red blood cell volume, or measured blood volume. In general, no evidence exists that deer velvet powder or extract enhances testosterone, erythropoietic properties, or maximum oxygen consumption in people participating in aerobic training. Stimulants. These may include ephedra, ephedrine, and pseudoephedrine. Athletes may be drawn to products that enhance energy and improve body composition, and may consume nutritional supplements containing the Asian herb ma huang, also known as ephedra. Ma huang has been associated with various medical remedies in Asia. It consists of ephedra and pseudoephedrine. These are commonly found in nasal decongestions. Ephedra was one of the plethora of nutritional supplements marketed to people attempting to lose weight and athletes hoping to enhance performance. The FDA issued a warning about this use in 1996 and 2003 and reported greater than 16,000 adverse events secondary to ephedra use, including heart attacks, strokes, seizures, and even sudden death. In 2003, the FDA announced that it was banning the sale of ephedra after it was linked to the death of multiple high-profile athletes. Pseudoephedrine is a popular over-the-counter decongestant that is commonly available at drugstores. Since it can be used to manufacture illicit drugs, such as crystal methamphetamine, proper identification is required at the pharmacy for purchase, and a limited monthly purchase has been set. Professional hockey players claim to use pseudoephedrine products for their primary purpose as a decongestant, noting that their competitive season occurs during the cold and flu season of winter. However, research published in 2006 indicated that 26.8% of intercollegiate hockey players had taken pseudoephedrine under the auspice of enhancing performance within the last 30 days. In summary, athletes have incorporated nutritional supplements into their training regimens since the origin of competitions. Medications and supplements have been used inappropriately with the hope of gaining a competitive edge. We've explored several supplements commonly taken in ways that have limited evidence supporting their clinical use in treating neurological and skeletal conditions. Unfortunately, some medications and supplements intended for patients with medical conditions have been used to enhance athletic performance. Athletes need to be aware of which supplements are banned, for athletic competition. Additionally, consumers should be aware that the claims listed on some supplements may not be based on human science.